While it's a vital resource for families, KU Health Systems has begun the process of closing its pediatric intensive care unit.
Leaders say low patient numbers led to the closure. KU telling us they averaged one patient a day. As KCTV5's Gabby Luma reports, existing patients are moving to a different location.
University of Kansas Health System officials actually tell us that they are working with Children's Mercy to transfer their patients over to their PICU. Now, this actually comes as Children's Mercy, they just announced their new tower to meet the rising pediatric care demand. Now, the two hospitals have been in collaboration since 2000, where patients who age out of Children's Mercy are transferred to KU, among other transfer clinics. Children's Mercy is just miles away, with the majority of our region's complex pediatric intensive care already handled there. The closing of KU's PICU will allow for more neonatal intensive care unit patients, which is over capacity nearly every day. For comparison, the PICU had 0 patients 25% of the time. No jobs will be dissolved in this transition, and Children's Mercy officials say they're ready for it.
With the average census that KU was holding, we are more than capable of taking care of those patients in the beds we currently have, but the need to grow those beds over time we are aware of, and that's what we're excited about our tower expansion.
There's currently no confirmed date of the closing of that PICU, but the health officials here, they say they're working with Children's Mercy along with patients and their families to allow for a smooth transition. Reporting from Kansas City, Gabby Luma, KCTV5 News.